Hi everyone, my name is Chantel. I'm a massage therapist, and today I just wanted to highlight some of the work that I do. My favorite work is the upper body, but sometimes I get to venture to other parts of the body, and today I'm working on my client's leg. She has been dealing with chronic leg pain, body aches for about 2 years. She was in a car accident and her side of the car was impaled and her door was stuck, and she had to use her body to get out of the car to open up the door. So her hip took the brunt of the pain or the injury. So now I'm working on a knot in her quads, doing some vibration, just trying to get some blood flow there and just break it up a little bit. Again, I'm always trying to relax the client. So yes, some of the work can be painful, but they are not in excruciating pain. I'm always checking in on the pressure and if they need a break from the work, because with the work that I do, I tend to focus. So I am not the massage therapist that will just do the fluff and buff, if you will. Unless, of course, that's what my client requests. Like if my client just wants to relax and they don't have tension or they just don't want to deal with it, then by all means, I will give them a full body massage, and it'll be the best full body massage they've ever had. But for most of my clients, they're coming to me because they have chronic pain in their muscles, and they're trying to get rid of that to have a better quality of life. So I've been working with this particular client for, maybe like 4 months, I think. She also has a very busy life, like really busy. She's always on the go. So her recovery time is shorter because she's always on the move. She's gardening, she's dealing with her children and their sports and, just everyday motherhood stuff. She is definitely a super mom. I give her that. She is a wonderful woman. As you see, I just put the cups on, and this is again to pinpoint the knots or the adhesions in the muscles. There's 2 of them. They were pretty big. So now I will work around them because, of course, the rest of the muscles still need some love. Sorry, my hair was in the way, but I'm sure that you can use your imagination to figure out what I'm doing there. Just still trying to work that tension out in the muscle. And she was super duper moisturized after this session, especially that leg. Because I also like to, if the client can take it, I like to work with the cup also after, before or after I let the cup sit for a while. I think this particular time I let the cup sit for about 10 to 13 minutes, something like that. This was a long session. This was a 90-minute session, or maybe this was 75 minutes that day. We ran out of time. But yeah, I let it sit for quite a while. And now I'm just moving it. The reason I move the cup around is to continue to break up any of the adhesions that are still in the muscle. And you see her leg is twitching. I checked in and maybe it was starting to hurt, or it was probably getting dry. Yeah, it was getting dry. So here I am getting more lubricant, and I use gel lubricant. That's my favorite right now. So yeah, you never want the cup to be dry because then it feels like a burn, and that's not what I want. Remember, we want comfort and relief, and those two things can be accomplished at the same time. So now she feels much better with that lubricant on. And I don't think that I do this for too long, because again, while the cups were on, I was still working the area. So just checking in with that to see how that muscle feels right now. And I'm sure that if I went back to the beginning of this video to see how the tissue was moving, I'm sure that the tissue is moving more freely now. I might do that, but maybe you can do that while you watch. Go back to the beginning, check out the movement in the tissue, and let me know if you notice a difference between then and now. But I'm sure when I was doing this, it felt more pliable. Now, I'm always going to use a forearm and elbow as much as possible, especially on the leg, because these are bigger muscles, the quadriceps. And I'm not slowing this down or speeding it up. This is the natural pace that I work. And the slowness is for the fascia to release. And in turn, those adhesions continue to break up. And then, you move the toxins through the body, getting those toxins that were clumped up or stuck in that adhesion area. I really love what I get to do every day with chronic pain clients. I also receive referrals from a pain management neuro doctor, I think something like that. But she's a pain management doctor. She is fantastic. All of her patients that come to me rave about her and sing her praises. So I'm so thankful for that partnership. And I'm sure that I'm almost done working her leg. But I know that I've spent a good while on this thigh. Probably like 25 minutes. It could have even been 30 minutes. Honestly, it could have been longer than that. I really wasn't paying attention to the time this day or for this session. And throughout this whole session, we're having great conversations. We're talking about the beach and just summer vacations. So, and I tell you this just so you know that she was totally relaxed. And I am not doing anything to cause significant pain or discomfort to my clients while I'm working. That is never my intention. I truly love what I get to do every day through massage and just helping people to heal their bodies. And it just brings more awareness to their body. I think the more massages you get, the more aware you are of your body and how you feel. Now I moved up to the hip. Sorry you can't see, but I'm just doing some circles with a soft fist over that area where I had the cup at. You notice the hip cup was there the longest. And that's because that's where most of her attention and that's where most of her issue was coming from, that hip area. And a lot of time was spent up there at the hip. And by the time I ended this area, she did notice a huge difference. Now, will it be back this way the next time she comes in? It might, because she's a busy lady. But it's never as bad as it was. So I've been working with her for 4 months, and she has improved a lot. We are ending this segment, and the video is over. Thanks for watching.